Nowhere is the significance of the Reform Act in '97 and the Bucks for Brains funding in '98 more apparent than it is with our Kentucky Spinal Cord Research Center. Since the late '90s, the state has invested $19.2 million in this program, from Bucks for Brains and then from the little court fee that we get as part of if you're speeding along the highway and you get a speeding ticket and you pay your fine, you also pay court costs, and a portion of that court cost comes to support us. And from those two revenue sources, we've received $19.2 million to support our work at the Kentucky Spinal Cord Research Program here at the University of Louisville. The amount of funding that we've generated in that same period of time has been $68.8 million. That's a pretty good return on the state's investment. And in 2011 alone, year's not over, who knows what may happen in the next month, but we've generated $13.7 million in funding in 2011 alone.
If you've seen what I've seen over in Frazier Rehab, and that's one of the first patients that Jonathan and others and his whole team and Daryl have treated, standing up where they couldn't stand before and watching the muscles in their leg work, you'd believe in a miracle. Well, in fact, it's not a miracle. It's what we do in health sciences. It's the so-called bench to the bedside approach, where basic science researchers, people who do clinical trials, people who operate on patients, who treat patients, all come together in a multidisciplinary fashion, put their brains together, if you will, really think about novel ways to deal with diseases that two centuries ago were untreatable, and in fact 2 years ago were untreatable.
We have patients coming from all over the world to come to Louisville to enroll in the rehabilitation programs, and both from a treatment standpoint and a research standpoint at Frazier and U of L with Susie and Daryl. Importantly, though, what isn't quite as splashy, but I think is equally as important, we have postdoctoral fellows and graduate students that come specifically to the University of Louisville to work with our scientists. The fact that this research group is here has enabled neurosurgery and Dr. Hodes and his colleagues to recruit the absolute best of residents. Those trainees are then carrying forth what we have started here, and it is the center is a very strong resource and a real strength of the portfolio of the University of Louisville.